Hi, it's Matthew Links and welcome to this video on how to obtain a consent for a clinical trial. This is a key skill for any investigator and one that really takes a lifetime of practice. The framework used in this video for this topic is that of SPIKE, which is a communication framework commonly used in oncology for the problem of breaking bad news. And although this is not a breaking bad news story, it is a highly complicated and emotionally laden context for information giving. So it's a useful framework for dealing with this. And SPIKE stands for Setting Up, Perception, Invitation, Knowledge, Emotions and Summary. I'll just show you how each of these applies to the communication issue of obtaining informed consent. So our learning objectives in this video are to be able to adapt and use the SPIKE protocol for consenting to clinical trials, to identify the actions that you can take before a consent discussion to meet the patient's information needs, and to identify some strategies for promoting understanding during a consent discussion. Also need to be able to understand the ethical issues involved and the importance of equipoise. So before you get involved in a complicated consent discussion, it's worth checking two things: that the patient is potentially eligible and that they are potentially interested. Now, you won't necessarily have all the information to know whether a patient is eligible. Some tests are required to be done after consent has been obtained, and these are the protocol-specific tests for eligibility. However, it makes no sense to have a consent discussion with someone who's not eligible. So find out that before you start. And the second thing is that it doesn't make sense to have a long discussion with someone who's not potentially interested. So if they're not in principle interested in discussing a clinical trial, then you should be able to move on. Now, there are a couple of steps that you can do in the setup to improve the consent that you obtain. And the first one is to be informed yourself. There's a couple of sources of information that are crucial for this. The first one is the clinical trial protocol, and the second is the consent form. The consent is really a simplified, structured telling of the issues involved in the trial. So the first thing that I would highlight is for you to understand what the rationale of the trial is. Have a close look through the consent form. Look closely at the schedule of investigations, because that gives you an idea of what the time impact on a patient will be and how much investigations and visits to hospital they will have. And finally, understand what the alternatives that face this patient are. The second step I recommend is to put yourself in their shoes. Would you go on this trial? And if you were going on it, what would your concerns be? And where's the balance lie in this study? If you wouldn't go on the trial, then there's a real problem, and either it shouldn't be going ahead or the issue should be resolved so that you understand where the equipoise lies. And the third step is to get organised, and the principles for this are really the same as in breaking bad news. You need to find a location, privacy, make some plans so significant others like family can be present. Make sure that you can set up a time where the trial coordinator can be there preferably, and make sure you've got the protocol to hand and question. Now, the P in SPIKE stands for perceptions, and you really need to understand why the patient's there and what they understand about trials. The perceptions about trials and misperceptions can really impact on trial recruitment. And the I stands for invitation. You really have to have permission to be able to undertake the discussion. You need to be sure that other issues are out of the way, so this is the appropriate issue to discuss now, and confirm that now is an appropriate time and venue. And the K stands for knowledge, and there's a lot of knowledge to be given and communicated during this discussion. And it's useful to think about what are the fundamental things and then what are the details. And two issues that I would emphasise about fundamentals are, one, the voluntariness of participation in clinical trial. It's important to get very straight early on. And the second thing that often will determine whether a trial is right for a person is how they handle the uncertainty. And a limiting step for a lot of patients in a lot of trials is coping with the uncertainty about efficacy or toxicity. These are useful to get out of the way early, understood early. And then there are the details about the particular trial. You want to be able to put the trial question into this patient's context. That this patient has had 2 lines of treatment and there is no standard treatment, or that the standard treatment is X, that's what would be recommended, but there's a possibility of improving that. The second thing is to identify what the rate limiting step is. Every trial has a rate limiting step for recruitment, and it may be the coming to hospital every week for infusion, it may be the concerns about increased toxicity, it may be having a placebo, it will vary from trial to trial. But you should identify with the coordinator what the issue most patients stumble over, and identify that and get the patient's view on that early. This can save a lot of time if they're never going to turn up, never going to agree to turn up every week, for example. And then it's a matter of working through the informed consent document. The main tip for improving the consent process is to provide time. And it's not reasonable to hear about a very complex file and then sign on the dotted line immediately. Good practice to give the patient a discussion, consent form, give them some time to discuss with the family, and a follow-up phone call from a coordinator to confirm that they want to go ahead is good practice. Now the E in SPIKES can stand for equipoise or emotion. And equipoise is really the key concept in consent. It's about balancing the risks and the benefits and understanding what they are. And it's also important to think about what the practical implications for a patient are and how that might impact on their perception of risk and benefit. And the E for emotions, it's very important to acknowledge potential anxiety, emotional responses that the patient has with often overwhelming load of information. And this overwhelming load of information or data deluge is one of the main ethical issues towards having meaningful informed consent. Because there is a risk that if we do not do it properly, that informed consent is not meaningful. Other really important critical ethical issues are to acknowledge that there's a potential conflict of interest. There is a conflict of interest between our role as an investigator and that of the patient advocate. And this is important to acknowledge and to prioritise the interest of the patient. It's possible for there to be covert pressure. An important concept is that of therapeutic misconception, where patients often will overestimate the size of the benefits of losing the drug. The understanding the ethical basis of placebo-controlled trials creates a lot of as well. But informed consent is an ethical test for us as practitioners, and it's important part. And then the S stands for summarise. To go back over the key points of the trial, check understanding, and to provide an opportunity for assessment. So that's the SPIKES approach to informed consent. Setting up is about identifying the right patient, reading up yourself and putting yourself in their shoes. Perceptions about clinical trials are important and need to be identified. Get an invitation to proceed. And then communication of knowledge is then what it's all about. Remember that the information can be overwhelming. The patient needs time, and be very careful to present both sides of the argument which is the basis of equipoise. E stands for acknowledging emotions and ethical issues, and finally summarise. There are a few excellent sources that can support you in this. You should know the GCP guidelines on informed consent. There's also a guidance from the General Medical Council of the UK, and I've put a few interesting articles, including a reference from Melbourne looking at satisfaction with clinical trials, consents, systematic review of increasing recruitment, an interesting little article on the role of regret, and finally a clinical trial demonstrating that a short communication course for physicians can really impact on the quality of patient consent. That's all. Thank you for your attention.